Hi, so my name's Joe Sawyer. I'm a palliative care doctor and also a research fellow at UCL. And I've written the chapter on, along with Libby Salmo, on the evidence for effectiveness of a public health approach in palliative care. So for me, compassionate communities and new public health approaches are a unique way of looking at the end of life care. And communities and relationships are complex. They don't necessarily lend themselves well to thinking about evaluation or effectiveness in the traditional sense. So you can't simply take community A, build a compassionate community, convert it into community B, and so forth. And the reality is it looks a little bit more like this, where new ideas can lead to an intervention, but how it will unravel in the real world is highly variable. The outcomes are not always predictable or indeed visible in the places that we're used to looking. And they may take years or even generations to manifest in the first place. Because compassionate communities are complicated, they don't necessarily fit a simple scientific model of evaluation. You instead have to think about things a bit differently and pay greater attention to context, culture, and have an open mind when it comes to thinking about outcomes of interest. This is perhaps probably my most important point in the chapter, because sometimes it can feel that the clamour to provide evidence of an effect can sometimes dismiss what's important to know and to understand in the first place. So with this in mind, the chapter describes what we might understand by effective, from a better care to the potential for better care, demonstrating the importance of human compassionate relationships. So I've reviewed most of the scientific literature as part of my work, and I've categorized the evidence into two main sections. The first relates to a community's capacity to act as an agent of care, and the second is about how they do this. And here the evidence is all within processes and techniques used in developing a community's capacity to care. So I write about social capital, community engagement, empowerment, responsibility, and motivation, what drives us to make a difference. There's lots and lots of positive evidence, but it's not necessarily uniform. And that's okay, it's just reflective of the complexity and the importance of local context and culture and the individual needs that exist within it. So to summarize, the chapter is meant to challenge the world of academia, policymakers and activists into thinking a bit more creatively about how we evaluate this work and how we demonstrate effectiveness. The emphasis being not to reduce a complex topic into a standardized intervention that fails to develop community capacity in real terms. Thank you.